We run away to get us up when we're low. Just chase the waves, we'll make it up as we go. If you're heavy, I'll show you where to go. Won't you set free? Behind the town for love, we run away to get us up when we're low. Oh, even if I lose my ground, I won't let it hold me down. We will go.
Hello, welcome back to this episode again, and we're here in Tower Bridge, and I've decided to just film with my friends. All of us are working in the NHS as nurses, but in different areas. So I'd like to use this time to share our experiences as nurses working in UK and in London. This might not be the same for everybody, but I hope that in one way or another you can learn a little bit something about our experiences. So here's Mark and Kevin.
Hello guys, how are you doing?
Hi.
Hello, so do you mind to tell us more about your experiences or introduce yourself?
Hi everyone, my name is Mark. I'm working in Chatters in one of the NHS hospitals in Canada.
My name is Kevin. I'm working as an oncology nurse, one of the hospitals based in London. We're catering private patients.
Okay, so obviously we really differ in areas. I have a few questions here because I'm gonna forget what I'm gonna ask them. So first, what do you like about working in your area?
For me is because I'm working in Chatters, every day I'm working with a different team. So I'll be working with the same team for the whole day. So you'll be having a good teamwork, and you get to know people, how do they work, and how helpful they are for you.
How about them, Kev?
Yep, since our hospital is a cancer specialized hospital and our unit is specialized on gastro and urology patients, so we're able to learn about certain topics like that, and it's a part of a learning process, and we only have maximum of 7 patients, so we can able to render a good quality care to our patients.
Me, I'm working intensive care. I did not work intensive care in the Philippines before. I had 2 months of experience, but it's way different when I arrived here. So, in nearly 4 years working there, the benefit that I could identify is that the sense of autonomy, because it's like you can decide your own nursing interventions, granting that you know your stuff, but nevertheless, the relationship as well between doctors and nurses. Doctors really, how do you call that? They do prioritize whatever the nurses or appreciates what the nurses has to say, and they really value as part of the medical team. So that's it. And the cons in working in the ICU is that it's a very demanding and we handle very complex patients. So it will really test your skills in being efficient in managing your activities or clustering your nursing care, and the adrenaline rush. So it's very busy, but overall it's a very good place to work with. How about in theater, Mark? What's the cons?
I think one of the cons would be if it's a whole day list and there's too many cases for that day, you'll be very tired. Because for example, in one Chatters, there would only be 2 scrubs, so it would be alternate scrubs and circulating. So it would be very tiring for the whole shift. And especially if it's for long cases, sometimes you would stand for like 4 hours, 5 hours. So it would be very tiring at the end of the day. Yeah.
In our case, since we're working in a private care ward, so as I said earlier, we only have maximum 7 patients and 3 to 4 nurses a day. So the best nurse and patient ratio is being implemented, and we can able to deliver the best quality services to our patients, and also we can able to manage our time and make sure everything is adhered to the standards and principles of the trust.
I know that I've asked you about the cons, but can you name at least one, like the top challenge in your area, and how have you coped with that so far? Just one.
All right. Since we're catering private patients around the world, most of our patients are from Middle East, and it's kind of more a bit challenging because they don't speak English much more.
Yeah, yeah.
So we need a translator or an advocate for them. And moreover, we are more primary care method of nursing, which you need to cater all the needs of the patients from 11 and a half hours shift a day.
Yeah, so it's high work demand.
Yeah.
In theater?
In my case is like there would be some days that we'll be working with different people, and some of them were from agency. So I think the main challenge will be if you're working with an agency, you'll be running the list. So most of the responsibility will be yours. For example, you'll be most of the day will be circulating, since if the surgeon asks for a certain thing, the agency won't know where to get it. So you'll be the one circulating. I think it's like the work will be heavier than the ordinary days, in which you'll be working with someone from your own department. I think that's some cons to that counter work.
In ICU, since I've mentioned earlier, I haven't worked in ICU before. I think the greatest challenge is dealing with state-of-the-art technology and therapies. It's the things that you just read on books before when you were in the Philippines. And you have to be specialized in order to look after patients with this kind of very complex and special therapies. So it's a bit of a challenge because it requires a lot of training and competencies. But I was able to cope because we have a very good support from our education team. So when you arrive here in UK, you don't need to worry because they will treat you like as new graduates. So they have really a very good training and education programs in place, which will help you transition from being a novice to at least like efficient or confident practitioner. So yeah, that's good. So yeah, that's fine. I forgot what I was about to say because it's very cold in here. By the way, I think it's around 8 degrees now, and it's
We're chilling.
4 p.m. and we're in the River Thames, so it's very cold. So just bear with me, I'm sorry. So this is the next question. Oh, okay. What are just the advices that you would like to give for nurses, either if they want to come to your area or just to enter nursing in UK, practicing nursing in UK in general?
Yeah, I think one of my advices is just adopt with the department. Because when I first came here, I stopped working in the healthcare sector for like almost 2 years, and I had just refreshment of 2 months. So when I came here, it's like I started from the scratch. So good thing about here is when you arrive here, they will not bombard you with big cases. They will train you and will treat you, as Grace have said, train you as newly graduates. So they will teach you the basic until you become more confident to scrub or circulate on different cases by yourself. So I think the main thing is just be open to criticism and just be adaptive to what they are teaching you, and just focus on what you do, and always just make sure that you'll be on the safe side. Don't do anything that you're not confident to do.
Yes, that's very important, and they're very accepting of that. It's better to say no than to do things because you just want to impress people. They're really after safety, so it's okay to really say no if you don't feel confident.
Yeah, and one thing, when I scrub for a case that I'm not really confident with, I would tell the surgeon that I have done the case only a few times. So they're very considerate here. So I think the main thing is just be honest with who you're working
Yeah,
with the other scrub and
that's true.
the surgeons. I think that's the thing.
Um, a piece of advice to those nurses who are planning to go in the UK or you have your own respective specialties. I think first and foremost you need to go in line with what specialty you are currently right now, because when you come here you need to stick to what is your current status. I mean, if you are working in an emergency room, just go to the ER or theater, go to the OR, and if you are in the ward, go to the ward first, because here it's really easy to work, or you feel more comfortable to work in what is based on your experience, because it's quiet, challenging if you have experiences in theater, but you will be assigned to an ICU, because it's really they are more concerned about patient safety here, because they are more, what they call this, favorable
Yeah.
about what may happen to the patient. But of course,
I think everywhere in the world is.
yes, so need to stick to your specialty, and then if you find it very challenging or you feel you are fed up or you outgrown your specialty, you can able to request for what area you gonna work with, some sort of challenge yourself, some sort of new environment, and they're open to that situation. But of course, you will undergo induction again, you will have your modules and some sort of study days for able to cope up and able to manage and accept and adapt to that certain role. But all in all, there are a wide variety of specialty here, just long as where your heart belongs. It depends on you guys.
And if I may just add, they're very supportive of you switching specialties. So, as what Kevin said, that's like the easier way of getting here, and just to make you less anxious about transferring, to stick in your comfort zone at first. But you always have the time and the opportunities to transfer if you want more challenges. So I think that's that's a very good advice. And for me, I think is what I can tell you in the ICU environment is make use of all the resources that you have and always be assertive. For example, there's lots of trainings that they're offering you. So be assertive in learning, continuously learning, and make use of the people around you, the senior ones, and always be open for advice. It's just what Mark said. Those people who have trained longer and has been there longer will really give you a lot of inputs, and yeah, it will really make your stay there very nice and at least more comfortable. So that's it. I hope that you've learned something, and we're gonna stroll now around London. So I'll see you there.